side lying breathing. So now that we have a general understanding of what pressure management is, we're going to learn a breathing exercise that helps teach our body that. So when we're breathing, just a little review, we're looking for equal pressure in all directions. So making sure that it's not just an big breath in and pressure out on your diastasis. Making sure it's not just a big inhale in and feeling tons of pressure going down into your pelvic floor. We want to make sure that we can feel our ribs expand, our back expand, our pelvic floor relax, but not that feeling of kind of like dropping out from under us, okay? Make sure that we can get it to relax, that it's not clenched and you're just holding tension down there. So I find the best way to start with breathing is in a side lying position with lots of props. So we're gonna make sure you feel really supported. You don't wanna feel like this is putting strain on your back, especially starting out. Abdominals feel really weak, so we wanna make sure that you're nice and supported so that you can really just focus on the breathing. So I like using towel rolls or pillows. I'm gonna give you a couple options here. So we definitely wanna have our head supported. And then I also want a towel under our side just to help support our abdominals right now. We're not looking to strengthen our abs right now. We're looking to work on breathing. So give yourself some support. So that's gonna go under my side. Have a towel under my head. Now, if this is your second or third pregnancy and you really feel like your abs really weak and you don't have a ton of connection with them right now, you can also take a pillow, okay, and kind of curl yourself around the pillow to create a little pressure to help support your abs. That's totally fine, okay? So just find a position that you feel comfortable and nice and supported in. So what I'm gonna have you do is take your top hand, you're gonna place one finger at the base of your ribs. So the very bottom of your ribs is what you wanna find. You're gonna take your thumb and you're gonna place your thumb on the back side of your ribs, okay? So finger on the front, at the bottom, thumb on the back, and then you're gonna take the rest of your fingers and you're gonna place them in that space between the top of your hip bone and the bottom of your ribs. So in this position, I'm gonna take a nice big breath in through my nose. And then an easy exhale, emptying out the air, okay? And I want you to feel where that air goes. Can you feel in this front finger that we got a little expansion in the front of our ribs and a little bit in the belly? Can you feel with your thumb in the back when you inhale? Do you get some expansion into your back? Okay. And then I also want you to start trying to connect with that pelvic floor. When you inhale, can you feel the pelvic floor relax a little bit? Okay. Little bit, again, not that feeling of all the air is going in and kind of that opening or dropping out of the pelvic floor. Just a nice, easy relax. Okay, so again, inhale, you're looking for that nice 360 expansion, okay? And then easy exhale. All right. One more thing to note, if you tend to have a really tight neck, traps, upper back, you can take this bottom hand and place it at your shoulder. And when you inhale, just know, do you feel your shoulder creeping up? So it would look like this on the inhale. And that means we're sending a lot of that air up in our chest and our traps versus getting that nice big breath through our diaphragm and our rib cage, okay? So just keeping an eye on that, making sure that our breath when we go in gets a nice even expansion. And then ribs drop, belly relaxes, pelvic floor maybe gets a little bit of a lift as we exhale. Okay, nice and easy to start.